Okay, are we ready?
Ready as ever.
Perfect. Let's do it. Hello, everyone. In this episode, we will learn about the Sexual Health Rehabilitation Service and then explore how technology may be utilized to improve sexual health for people with disabilities. I would like to introduce Dr. Stacy Elliott and Rachel Nicoletti. Welcome.
Hi, Ian. Thanks for having us.
Thanks for having us. So my name is Stacy Elliott, and I am a sexual medicine physician, and I have worked with the Sexual Health Rehabilitation Service as a consultant for about 35 years. And Rachel is one of the sexual health clinicians.
Hi, my name is Rachel. I'm a sexual health clinician and a registered nurse with the Sexual Health Rehabilitation Service.
Can you tell us in broad strokes what the Sexual Health Rehabilitation Service is all about?
Our service is here to assess and manage the sexual distress and sexual dysfunction that may be experienced by our patients. We're also here to provide proactive sexual health support and education for our patients. Sexuality is a really complex biopsychosocial area of our health, and so we provide care that considers the numerous mental and physical factors that may impact our sexual health.
So we're a very biopsychosocial service, and we're medically based, but we certainly look at the broad area of psychological and social issues also.
So what types of care does the fertility component of your service provide?
Well, that's a good question. This portion of our service offers fertility information, sperm retrieval, and we follow patients and their families through fertility trials if required.
And who's eligible for these programs?
We see BC residents ages 12 and up who have a disability or chronic illness, such as spinal cord injury, brain injury, arthritis, amputees, multiple sclerosis, or other neurologic conditions. If you're unsure if you can be seen by our service, feel free to reach out to us and we can chat with you about that, or you can contact one of your healthcare providers to ask about if you are eligible for a referral.
Why are these programs important?
Well, we know that sexual well-being is super critical to our overall physical and mental health. For anyone, and particularly for individuals with disabilities or chronic illness, they can have more barriers to accessing these types of services or getting the information that they require. So we really do think that for a long time, this area of health has gone unaddressed, and we're here to help close that gap.
So what are the long-term goals of these programs?
So we've got three. One is awareness, one is empowerment, and one is innovation and research. So Rachel, tell us about awareness.
Well, awareness is really the key to getting people through the door and talking to us. So if you don't know that we exist, how can you access our program? So we work on awareness within the community and also through spreading the word to healthcare providers that are in acute and community settings so that we can get our service out there and get patients in to see us.
So tell us a little bit about empowerment.
Yeah, so that's the next step in our patient's journey. Once they come through the door and see us, we really want to be able to provide them with the education and support so that they can take steps towards improving their sexual well-being with whatever that might mean to them.
So we kind of facilitate and guide and on your own journey. And the other thing we do is innovation and research.
Yeah, so we want to be continually involved in research projects and initiatives to bring new knowledge into this area that ultimately translates into improved well-being and improved lives for our patients, right? So this is something that we're always dabbling in and one of our other primary goals.
And I have to say, it's the clients and patients that we see that bring to us all the knowledge and the peer knowledge, and it's really, really helpful in that area. So we're always looking for innovative things.
Where are these programs offered to people?
So we have two physical locations. One is at GF Strong, the other is at the Blusson Spinal Cord Centre near Vancouver General Hospital. And also we offer virtual services. So we do many consultations either through Zoom or on the phone.
And how does someone access these programs?
Our referral form can be found on the Vancouver Coastal Health website. However, if you need assistance or have questions about how you can be seen, you can contact us at the phone number on the screen.
As someone who recently received a consultation through this program, I must be honest, I was a little overwhelmed and surprised by the variety of technology available. Can you briefly explain how technology can be beneficial for a person's sexual well-being?
Sure, Ian. Perhaps to start, I'll clarify that our role is to act as a guide in assisting patients to discover and to see what technology is out there that might help them in reaching their goals. And sometimes people come to us with like a general feeling of distress or sort of like they feel like they're not expressing themselves sexually in the way they want, and they haven't quite worked through that feeling or emotion, because it's not an easy thing to talk to about in general. We don't generally meet up with a friend for coffee and start talking about our sexual lives, right? Sometimes we do, but depends on who you are. So when someone comes to us, we sort of look at, well, what is it that you're really hoping to achieve? What do you feel like you're missing in this area of your life? And then what technologies are out there that exist that can help you with that?
And somebody who loves technology, I'm really curious about this. What are some examples of technologies used by people with disabilities?
So that's a great question. And a lot of the technology that we end up perhaps suggesting as an option for our patients originally come from information that our patients have brought to us ourselves. So it's sort of like this circle of sharing of information. So certainly we do our own research, but the best way to know if a product is appropriate or something that's going to work for our patients is sort of those reviews that we get from our patients. So, in terms of technology, we know that it can really be anything from sex toys that have Bluetooth controlled apps where you can control it remotely from your phone. But technology can really be, even if we think about dating apps or immersive video games where you have an avatar, right? And we're seeing even more in terms of robotics now. So we're seeing some sex toys that are robotically controlled, that have movements that are much different than what you would see typically in a sex shop. And then we have technology that can alter our own biology. So help perhaps to change sensation, our ability to orgasm. And that's more of like a science-based technology. And I think that's the type of thing we're going to see more of in years to come.
So some of that technology that Rachel was talking about involving your own, nervous system, things like electrical stimulation of the spinal cord, some neuroplasticity that happens when people learn to recruit sensations and good sensations that can actually kind of change the brain to make things that were not once sexual more sexual for them. All of these are based on pleasure and safety, of course. But the pleasure part isn't often talked about in medicine, and it's always to get rid of something, get rid of a symptom. And I think part of what the Sexual Health Service does is give permission to have pleasurable sensations. And how can that happen in the environment that you live in with either a disability or a chronic illness? So one of the things the service tries to outline is what kind of groups are available in terms of technology. For example, there might be direct things for direct genital stimulation or stimulation of the skin, like vibrators. There might be things to assist with positioning. So certain things that will reduce spasm or allow you to, say, have better balance, for example. And there's certain things that you can buy online that might assist with that. Other things to help actually prevent pregnancy or encourage pregnancy, right? So contraceptive methods, that type of thing. So that's part of what the service can do. But we also sort of can't even keep up with the technology. So we might have, for example, in the sperm retrieval clinic, there's a very specific vibrator that we use that's being developed specifically for men with spinal cord injury to help with ejaculation. But that might not be the same vibrator that you would want to use in your own privacy for a different condition. So we can hardly keep up with the technology. That's why Rachel's right. I mean, our clients teach us more than anything. And so it's really nice to have a program like yourselves that sort of explores this. But it's not like we have a whole bunch of websites or personal information to share with you because it's really hard to keep up.
Makes sense. So where do people usually acquire this technology?
Yeah, that's a great question. So, these days there's certainly a lot of online retailers who carry good quality products. And, if a patient came to us for a consultation, sometimes I will suggest that they check out a variety of online retailers that we know have been around for a long time, are reputable. And some of these online, retailers have specific information for individuals with disabilities, both on their website, and the staff who work there actually have training about what type of technology or what sex toys might be more appropriate for somebody with a disability. So I was really pleased to see that this is starting to become something that's addressed in the community.
And how much do they cost? Is there like a range? Is it quite, are they quite expensive?
So there is a wide variety when it comes to cost. So let's take, for example, positioning devices. Okay, so positioning devices you can use a pillow or a couch cushion at home, and that's, we can suggest things like that. I don't know if that's considered technology, or there are things like for people with spinal cord injuries, chairs that you can sit in that have a certain type of support and movement built in that can give you more ability to be active in a sexual situation. I think it's called the Intimate Rider, that chair, and those are definitely going to be, a few $100s. And then when looking at sexual aids, you can get something really simple for like $30, or you can get something very techy, very niche, very high quality, and you can be paying, upwards of $350. And for the robotic devices, you're going to be looking around that range as well. And then for some of the really fancy hands-free sex toys that are out there, some of these I've seen for close to even like $700.
Something else the service does is advocate. If you do have insurance from an injury or whatever, that we do advocate some of this technology be covered for you because it's part of your disability.
And I think, well, something that was helpful for me was that going into a store and actually being able to see all of these sex toys, because when you look online, again, it can be so overwhelming. You don't know what the textures are or the physical size of them. So I found that was a huge help in speaking to people at the store, getting their feedback of what's popular and is this a good product, and also reading reviews, because people are very open on the internet about what they like and dislike. So I found that quite helpful.
Yeah, that's a really good point, Ian. I talked a lot about online retailers just because that's where I tend to look when I'm at work, but you're very right that if you can, get into a brick and mortar store and check out some of those items, even just to get started, to get an idea of what these products feel like, what they sound like even, right? Like for some people, they don't want something that's really loud, and some of these motors can be can be quite loud, or yeah, it is difficult to judge the size of things, as you said. So
And I think you also need to look, you kind of get what you pay for. The sex industry is so huge, and a lot of stuff is not good quality. So something for $20 is probably going to break. Whereas if you are able to get something higher tech, better quality, that's going to last longer. Some people want to be sure that it's waterproof. Some people want to be sure that it's rechargeable. All these things make a difference on how long and how good it is. And again, you have to be aware of things like, hand function, how sensitive is your skin to some of the technology. So just to be aware of that, and sometimes our service can help with that, or put you on to occupational therapists that can assess that for you, which is really important. Again, we're about pleasure and enjoying life, because we know sexuality is such a huge quality of life, and it has to be dealt with as part of our healthcare. And so we really want you to get the kind of best care that you can, and we try to direct you to resources that will do that.
And one thing Stacy mentioned that I think is important to say is that we do work with occupational therapists to help with, say, for example, adaptive, like a universal cuff, to help perhaps hold a vibrator for someone who doesn't have good hand function. So if you find a sex toy or something and you're like, okay, this is perfect, this is what I want, but I can't quite grasp it right, or I need some sort of a cuff, we can help you we actually have staff at GF Strong who have a little factory and sew those cuffs up and can make them custom. So
yeah, and physiotherapy also participates, psychology. I mean, we have those resources, which is great.
Excellent. So, what are some of the latest developments in the industry? I know it's expanding ever so quickly, but what is state of the art right now?
So it kind of depends on where you look. So if you're going into the academic world and looking at research papers, I found information about, I might be using the wrong words here, but I'm going to speak quite generally, like mind-controlled sexual stimulation. So they're putting like electrodes on somebody's brain and mapping out their brainwave patterns, and that is connected to a vibrator on somebody else. So just by thinking a certain way, in this study, they were able to have someone control a vibrator just by the way somebody was thinking. And so, those types of innovations are starting. They're not materializing into like the market where you can go and buy something like that, but I don't think it's that far off. And those types of devices, I think, could be really helpful for people who really don't have that physical ability to provide stimulation to a partner, right? So I think that could be really empowering for a lot of patients. One of the other studies that I wanted to speak about, and Dr. Elliott might have something to say on this too, this is there's an article in the journal of Neurotrauma, I believe. But so for individuals with spinal cord injury, they've started doing these implants, these epidural stimulation. Is that what it's called?
Yeah, either implants in epidural or through the skin. And that can sometimes, where it's very early on, because they're looking at sensory, motor, bladder, bowel, but they're including sexual function to see if there are some improvements. And there seems to be an indication right now that may help. And if you think about the neurological wiring of the bladder and the bowel and sexual function, it kind of makes sense. But all of these are enhancing what you already have. It's not like they're curative. And so it's all really new research to see if that can work. I think we have to look at sort of the spectrum of sexuality, right? In other words, your mind is your biggest sexual organ, but you go from being physical with someone yourself or with somebody else, all the way to just being in your mind, right? And so the technology varies. I mean, all the way from, virtual reality, which is your mind, all the way back to, using sex dolls. There's automated artificial intelligence sex dolls that are coming on the market now. Very expensive, speaking of expensive, but they're incredible because they can do all these things. They have skin that feels like, skin, all these fancy things. So it's really what you're looking for. If you're looking for intimacy in a relationship with somebody and the sexual part is just an expression of that, that's very different than somebody that wants to try to have an orgasm or try to have a release. And they're all in one big package, and we're happy to deal with all of that. We just don't have the resources to do the higher technology. We can just suggest some things to look at, but to help you put together or guide or facilitate to have a rewarding sexual life, whatever that may look like.
Well, and I think that's the fun part is the exploration. They're figuring out what works for you.
And that, figuring out what works for you, everybody is the same, right? Everybody has to discover things. And when you have some forms of limitation, you still have this wonderful body and brain that you want to figure out what is the maximum that I can get out of what I have. And then I can add in things to enhance that, right? But the other sort of principle that the Sexual Health Rehab Service goes by is if you can kind of push the envelope or keep a really open mind, that really helps you discover something that you might not have thought of before. And that expansion is available in sexuality. It may not be available medically, like with your mobility or your sensation or your bladder or whatever, but the sexuality can keep on expanding. That's why it's such an interesting, innovative field.
So, what are some advances you want to see or expect to see in the next 10 years, let's say?
Yeah, so I certainly would like to see continued research in the area of sexuality and disability specifically. We know that this is an area there hasn't been a lot of research, so I'd like to see that continue. And then with the apps that come along with a lot of these sex toys, I'd like to see them be open source. And so I'm not super techy, but some of them are open source and some of them aren't, which to my understanding means that if it's open source, somebody can go in, see how the code was put together and make suggestions or even change that code. Is that how you understand it, Ian?
It is, yes. And that allows people to create their own apps and really take that technology to a whole other level.
I think the more vocal and the more insistent the disability groups are in saying, hey, this is really important. I mean, basically, if a developer develops something for somebody with some limitation, it's going to be there for anybody, right? So instead of going for the general population and a little narrow part for disability, if you do something for disability, it's going to be fantastic for everybody. So I think there needs to be a voice in the community, don't forget us, and that we're really the role model for everything else you do.
Yeah, and I am seeing a lot more on the internet where people are expressing themselves and asking those questions, which is so important because it can be a somewhat taboo topic, and it really shouldn't be. I think it's something that is natural, and I really hope that more people will explore and ask those questions. And I'm really happy that there are services like yours where people can feel safe and are in a safe space to find information and learn more about this important topic. So thank you.
You're welcome.
You're welcome.
It's nice to chat with you guys today.
Yeah.
So thank you very much for joining us, Dr. Elliott and Rachel. It's been an excellent chat with lots of resources. Throughout the talk, we'll have been putting resources, links, pictures, and phone numbers up on the screen. If you missed them, you can also find them in the description. So thank you very much for joining us. So like, subscribe, and comment if you have questions, and we'll see you for the next episode.